My question: is postpartum depression and psychosis a passport for new moms to be lazy, or is postpartum depression and psychosis a psychological health issue that turn once serious moms into cold-blooded murderers? In this article, my objective is to obtain as much information as I can about postpartum depression and postpartum psychosis, and to be able to get this published to the public, as very little is known about the symptoms and the dangers of postpartum depression and postpartum psychosis. I really do not know if it's because of the media that it is now known that mothers killing their children is sometimes related to this sickness. The percentage of mothers suffering from postpartum depression and postpartum psychosis is on the rise, and the percentage of mothers killing their children is also on the rise, and one has to know that these two issues are related. I would like this article to alert people to the fact that if one knows a mom who was excited, happy about her new bundle of joy, and all of a sudden has changed and now doesn't seem to care, she doesn't clean, cook, or seem happy anymore, that it might not be a lack of interest or that she's lazy, but suffering from postpartum depression, or worse, a silent killer, postpartum psychosis. To most women, the birth of a baby is a joyous and wonderful occasion, probably one would say the happiest day of one's life. Unknown to some of these mothers, an enemy made of darkness, a mental disease lurking in the very recesses of their minds, just waiting to pounce on this happy occasion, turning it into something ugly, dark, and even deadly. It will destroy their lives forever, unless they receive the help they need as quickly as possible. This darkness or mental disease is known as postpartum depression, and worse, postpartum psychosis. According to the DSM-5, depressive mood onset can start during pregnancy or postpartum. It is noted that between 3% and 6% of women will experience the onset of a major depression episode during pregnancy or in the weeks following delivery. 50% of postpartum depression starts before delivery and are referred to as peripartum episodes. An article is written by Pores suggested that experts estimated that 25 to 75% of all new moms experience the baby blues or depression, and that 10% develop most postpartum depression, and that 1 or 2 of 1,000 women will develop postpartum psychosis. 1 or 2 in 1,000 does not sound like that many until you know that in 2004 there were over 4.1 million births in the United States alone. This is 4,100 to 8,200 women who experience this very serious illness per year. And given the rates of suicide and infanticide related to postpartum psychosis, this estimates a risk of over 300 infants killed and more than 400 mothers committing suicide because of postpartum psychosis each year in the United States. When a young child is murdered, the most frequent perpetrator is the victim's parents or step-parent. There are different names for child murder at different ages. Maternal filicide is a child murdered by its mother. Infanticide is a child murdered in the first year of life, and neonaticide is an infant who is murdered within the first 24 hours of its life. An American macro-level study of infanticide was done, and it was found that the rates increased with economic stress. Maternal infanticide studies was done in the general population, and a predominance of unemployed mothers in their early 20s were the perpetrators. In these cases, it occurred in the context of child abuse, and the moms suffered from psychiatric disorders, and some even attempted suicide. General population studies shows that these moms are often poor, socially isolated, and full-time caregivers who were victims of domestic violence or other type of relationship problems. Over 1/3 of the homicides occurred during pregnancy or postpartum year. Almost all of these mothers had altruistic or acutely psychotic motives. A study was done in New Zealand where these mothers were interviewed, and it was found that psychotic mothers who committed filicide often killed suddenly and without planning, while depressed mothers have contemplated killing their children for days and weeks prior to the actual crimes. Freeman and Resnick, 2007, almost 16 to 29% of filicide ends with mom killing herself also. Many make non-fatal suicide attempts in association with their filicide, and usually when a young mother commits suicide, approximately 5% of them will also kill their children, or at least one of their children. Suicide, according to recent studies, have much in common with filicide committed by severely mentally ill mothers. Recent American filicide studies have shown that maternal filicide suicide perpetrators killed older children more often than infants. These mothers often had evidence of depression or psychosis and will take most often the lives of all their young children. Depression and psychosis had other effects on families too. besides suicide and infanticide, such as cognitive, emotional, and behavioral outcomes for children. This also includes an increased prevalence of childhood psychiatric disorders. Suffers from postpartum depression also practices bad sleeping habits with the infants, such as putting them to sleep on their backs and with a bottle. While this disease is clearly difficult on the mother, it also severely impacts her parenting, which in turn impacts the development of the baby. The mother-infant relationship and the psychological and physical health of the baby may suffer as a result. Mothner 2010 also believed that psychological and sociocultural factors play very important sociological roles in the disorder. He believes that after the birth of a child, there are major psychological and social changes in the life of a mother, such as her marital relationship, her daily routines, and her social life. She lacks sleep and time for herself. Financial pressures may increase. All these added stress may cause a higher risk of depression. Recently, evidence has been found that connect postpartum psychiatric episodes with immune-related disorders that have similar etiological mechanisms, such as preeclampsia. Preeclampsia is one of the most prevalent immune-related disorders of pregnancy. The result, precautious women were at a particularly high risk of first-onset psychiatric episodes during the first month of postpartum. Besides the fact that evidence has been found of a link between preeclampsia and postpartum psychosis, there is also a link between mania-affecting psychosis and hypertensive disorders in pregnancies, and it has been recognized for over 160 years, but potential biological mechanisms undermining the link between the two conditions have, however, been poorly studied and characterized. In the present study, they have explored whether it's consistent with its proactive effect in preeclampsia. Smoking is associated with decreased rates of postpartum psychosis in women with DSM-5 bipolar I disorder. The association remains significant after adjusting for occupation, education, and disease severity. They found that the association was specific for postpartum psychosis and did not extend to women who only had postpartum non-psychotic depression. As with everything that concerns postpartum depression and psychosis, much is not known about this research, and many more studies are needed in order to be sure about the effect of smoking and its link to postpartum psychosis. Symptoms of postpartum depression are usually sadness, agitation, irritability, changes in appetite, feelings of worthlessness and guilt, feeling withdrawn and disconnected, lack of interest in usual activities, loss of concentration, lack of energy, problems with work, at home or in the office, significant anxiety, thoughts of death or suicide, trouble sleeping at night, unable to care for herself and the baby, afraid to be alone with the baby, having bad feelings about the baby, which might even include harming or killing the baby, and worrying intensely about the baby or not caring for the baby at all. Symptoms of postpartum psychosis are delusions where the mother is convinced her baby is the devil. She has hallucinations, hearing voices in her head, extreme anxiety, confusion, disorientation, disturbed sleep, and illogical or chaotic thoughts such as killing herself or the baby or both. June 28, Andrea Yates was treated for postpartum depression and psychosis. And after the birth of her fifth child and the death of her father, Andrea Yates went into severe depression. She was forcefully admitted to the Devereaux, Texas Treatment Network. Andrea Yates killed all 5 of her children. Andrea Yates claimed she drowned her children because they were not developing right and because she realized she was not a good mother to them. The police recounted how when they arrested Andrea Yates, she was very polite and could recount twice the order in which she had drowned her children. Andrea Yates also told the police she wanted her hair shaved so she can see the number 666, which is the mark of the Antichrist, on her scalp. Throughout the trial, Rusty Yates, Andrea's husband, stood by her claiming it was the illness that caused her to murder the children. Melia Gordon was another victim of postpartum depression. Postpartum mood disorders are more common than we realize. Approximately 80% of new moms experience baby blues within a year of giving birth. If these symptoms persist, depression can then escalate to dangerous levels, causing some women to experience postpartum psychosis, which in rare and tragic cases has caused moms to kill their children. Jennifer Moyer was another victim. Postpartum depression is debilitating, but postpartum psychosis is an actual break in reality, where one cannot discern between right and wrong. A woman in the throes of a full-fledged psychosis episode does not know right from wrong. She cannot differentiate where she ends and baby begins. Very often she will experience a psychosis, a very frightening sense of merging. Psychotic measure is so terrifying that she may try to avoid losing her sense of self by committing suicide or infanticide or both. This is known as proxy. Postpartum depression has been around for a while, but was not taken seriously, and many experts believe it is not being properly diagnosed. As the knowledge of postpartum depression grows, healthcare providers are now looking for risk factors in their patients as early as their first prenatal care visit. One known treatment for postpartum depression is the Fisher-Wallace cranial stimulator. This treatment became well known since it was commented upon by actress Brooke Shields, who shared her experience with postpartum depression and the treatment she received. Many people have commented about the treatment that was used because this treatment does not rely on medication, and it was approved by the Food and Drug Administration as a safe and effective way to reduce the stress that leads to depression and other psychological problems. The Fisher-Wallace cranial stimulator consists of a headband, 2 sponge applicators, and a base unit. Sometimes postpartum depression goes away without medication, give or take within 3 months of giving birth. Regardless, postpartum depression interferes with activities and behavior. If postpartum depression lasts longer than 2 weeks, one should seek treatment immediately. 90% of women who suffer from postpartum depression can be treated successfully with medication or a combination of both. The recovery from postpartum depression or psychosis is a deep personal process that involves changing one's attitude, values, feelings, goals, skills, and roles. It is finding a way to live a life that is satisfying, hopeful, meaningful, even with the limitations caused by the disorder. Recovery then involves the development of a new purpose. When one moves beyond chaos of the mental suffering, friends and family members and professionals are all very important to the recovery. It is important to the mom, regardless of mental illness, that she feels respected, accepted, seen, and heard. However, the most important aspect for her recovery is her own determination and faith that she will get through this. Understanding the illness and the hardship of the illness will also help. Unfortunately, most cases of postpartum psychosis do not have a happy ending. They usually end like the sad story of Andrea Yates. At the time of the unfortunate tragedy of Andrea Yates, not much was known about the seriousness of postpartum depression and psychosis. Today, there is more known about postpartum depression and psychosis, but still not enough. Postpartum psychosis is a monster mental health problem. It's a killer that needs stopped, and the only way we can do this is by getting the necessary information out to the public, and by surveying moms while still in the hospital, and by taking all evidence of depression into serious consideration, whether it be a small issue or a large issue, as it might lead to postpartum psychosis. Postpartum psychosis is a killer, and the only way for us to stop it before it gets too far is to get information out to the public, for families to be aware of the seriousness of depression and psychosis, for families to be there for these new moms from the start, and for the doctors to know the signs before these new moms. The review and research done has shown little that is known about predators of mothers who murder their children, and that a systematic, more focused program of research on reliable markers for mothers who commit infanticide is needed to better prevent these murders from happening. This is heart-wrenching to watch a once happy mother now the murderer of her own baby or children. If any family members, friends, or neighbors know of a woman who recently gave birth and now seem overwhelmed, depressed, or withdrawn, I beg of you, please take it upon yourself to seek help for that new mom, because their life depends on their getting help as soon as possible.